By doing all the things beforehand, you're giving yourself something to do when you could be getting quite anxious. You go shopping in. It actually takes your mind off maybe what's happening as well, because you're getting yourself organised for coming home after the operation.
Before your operation, you will receive a letter which will let you know the date of your operation, where to go on the day of your operation, and when to stop eating and drinking. Please read the letter carefully and pay attention to details of arrival time and eating instructions. You will receive this letter in the post, or you may be given it in the clinic if the date of your operation is quite soon. You may wish to discuss the details with a family member or friend so that you can start making plans together for the time around the day of your surgery. You will need to make arrangements regarding how you will travel to the hospital and how you will get back that day. You will not be able to drive after a general anaesthetic, and it is not advisable to use public transport, as this often takes longer and is less comfortable. You will need to arrange for someone to come and collect you from the hospital and to stay with you for the first 24 hours. This could be a friend, relative or partner, and doesn't need to be someone you usually live with. Sometimes patients find it easier to make arrangements to stay at someone else's house for the first 24 hours. You are likely to be able to do normal tasks at home and look after yourself after your operation, but it is important to have someone with you initially, just in case you do have any difficulties or need any help. It is very unusual to need to return to the hospital in the first few days after an operation, but it is helpful if you can make arrangements with someone who would be able to drive you back to the hospital just in case. You may wish to make plans with other people to help with childcare or housework, or to help with tasks that you normally carry out so that you can give yourself time to recover from your operation. Remember, it is okay to ask for help from other people, even if they would not normally do this. People are keen to help when someone has an operation, but they may not exactly know how to help. People having surgery find it useful to have both practical and emotional support. You may wish to go food shopping before your operation, as this will save you having to go out and do it in the first week or so afterwards. While you are likely to be well enough to leave your home, it is not advisable to carry heavy bags, and you may feel like having a day or so recuperating at home. You may wish to just do your normal weekly shop, or you may wish to treat yourself to a few of your favourite foods or to stock up on fresh, healthy fruit and vegetables. Remember to include pain relief medications on your shopping list. We would recommend you take these after the operation to control any pain you may have. We expect you to feel comfortable after the procedure with only minimal pain, so simple over-the-counter pain relief like paracetamol or ibuprofen will be sufficient. We would recommend you buy whatever is your preferred pain relief medication, the same type that you would normally take for simple pain like a headache. You may wish to prepare food in advance and put it into your freezer so that you have a supply of food available for the first few weeks after your operation. Alternatively, you could buy pre-prepared food from the supermarket. You will be well enough to make drinks and make simple meals for yourself after your operation, but you may wish to make the time after your operation easier by preparing ahead or by someone else cooking for you.